Welcome to this demonstration of the KenSci Clinical Analytics solution, built on Microsoft Cloud technology. This secure risk prediction platform helps healthcare service providers forecast clinical and cost outcomes, model the risk of patient readmission, and optimize care to help patients get and stay healthier longer. Chelsea Newton, Chief Medical Officer at a healthcare organization, uses KenSci Clinical Analytics to gain predictive insights into national health trends. From this Microsoft Power BI Health Analytics dashboard, Chelsea has an at-a-glance view of several key metrics, including the national health expenditure ranked by country, leading mortality cause in the U.S., and a variety of heart failure statistics. Chelsea can see that the leading cause of death in the U.S. is heart disease, and she drills down to identify which states are most affected. With Power BI Q&A, she can ask natural language queries, refining her search until she finds the insight she's looking for. In this case, she sees that heart failure mortality has decreased in California, but has increased in several other states. Chelsea pins the visualization to her dashboard for quick access later. With insights like these, she can work with the organization's data scientists to further investigate rising rates of heart failure and determine which patient groups need proactive intervention. Camille Ross is a medical data analyst at the organization who uses KenSci Clinical Analytics to accurately model the risk of patient readmission. In Power BI Desktop, Camille is looking for patterns in heart failure data to help the organization reduce readmission rates. When she interacts with this national heat map, she can see that heart failure has increased the most in the upper Midwest and Southeast. By using Sandance, a Power BI custom visual from Microsoft, Camille has access to rich modeling and animation capabilities. This report leverages U.S. Census data, so she can look for correlations in comorbidities, such as obesity and diabetes, as well as income and poverty levels, drug use, and more. Camille can easily change the chart to a 3D scatter plot, which she can rotate to see all the different layers of data in one view. To investigate further, Camille opens the KenSci Model Bank, where she has access to hundreds of machine learning-based models for predicting a variety of health and healthcare-related risks. In this case, she opens the model that will help her predict the risk of readmission within 30 days. Rather than start from scratch, Camille can copy the machine learning experiment the model is based on from Azure AI Gallery. The experiment opens in Microsoft Azure Machine Learning Studio, where she can iterate on the model design until she has usable results. When she visualizes the results, Camille can see that this model has high accuracy. To use the trained model to score new data, she sets up the experiment as a predictive web service. Once the model is ready, she deploys it as a web service so she can start sending it data. In this case, Camille has installed the Machine Learning Studio add-in for Excel so she can use the model on patient data she stored in a workbook. She runs predictions on the data, and Azure Machine Learning Studio immediately returns a scored probability for each patient, which she can add to each patient's electronic medical record for reference later. For now, she navigates to the KenSci Pulse app to gain deeper insights into the heart health of these specific patients. For each patient, she can monitor the current and predicted risks of readmission, low ejection fraction, which is an indicator of poor heart health, and mortality. With tools like these, Camille can optimize care for at-risk patients and help them stay healthier longer. Sergio Blake, Chief Financial Officer at the organization, uses KenSci Clinical Analytics to help mitigate care delivery costs. From this risk of readmission report in Power BI, Sergio can track the organization's number of high-risk patients, cost per discharge, and total readmission cost. He can drill down to review readmission cost by hospital, as well as by major diagnostic category. In this case, to see how diseases of the heart affect cost, Sergio filters on major organs and systems. He can even drill through to a cost mitigation report to forecast how a reduced readmission rate would affect the readmission cost. Additionally, Sergio can track KPIs around low ejection fraction and mortality. When he filters the data, he can see there are 43 patients with a high risk of readmission and low ejection fraction rate. He can drill through to the risk mitigation report for a particular patient, in this case, Ty Welker. Here, Sergio can see that if Ty improves his medication compliance, normalizes his blood glucose levels, and quits smoking, then he can reduce his risk of readmission considerably. Right from here, Sergio can leverage built-in Power Apps capabilities to share his findings about high-risk patients with care team members, saved to a HIPAA-compliant document hosted on OneDrive. He sends the report, ensuring care team members have the insights they need to work with Ty toward a more heart-healthy life. You've just seen how the KenSci clinical analytics solution helps healthcare service providers forecast clinical and cost outcomes, model the risk of patient readmission, and optimize care to help patients get and stay healthier longer. For more information, please contact KenSci or your Microsoft representative, or visit our website.